They found him sitting quietly in his living room. The television was still on. The lights were dim. There were no signs of trauma, no struggle, no dramatic event, just stillness. The kind of stillness that makes you realize something changed long before anyone noticed. The official report listed natural causes, and medically speaking, that was true. What doesn't get written on reports is the slow decline that sometimes happens in men as they age. The gradual withdrawal, the shrinking world, the quiet surrender of vitality that many assume is simply part of getting older. I want to have a conversation that many people avoid, not to shame, not to sensationalize, but to bring clarity. As men age, especially after 60, there are physical and emotional shifts that occur. Testosterone levels gradually decline, erections may become less spontaneous, energy may fluctuate, mood can shift, sleep patterns change, and for many men, sexual activity decreases. Sometimes by choice, sometimes by circumstance, sometimes because they assume it is no longer important. But here is what we need to understand clearly and calmly. Sexual health is not separate from overall health. It is connected to blood flow, it is connected to hormonal signaling, it is connected to mood regulation. It is connected to identity, confidence, and emotional resilience. Now let's address something directly. There is a common belief, especially in older generations, that masturbation is unnecessary or even harmful in later life. Some men stop because they feel embarrassed. Others stop because they are no longer in relationships. Some believe desire should simply disappear with age. Medically speaking, that is not how the body works. The male body does not have an expiration date for sexual function. What changes is circulation efficiency, nerve sensitivity, and hormonal output. And like many systems in the body, function tends to follow use. This does not mean constant stimulation is required. It does not mean obsession. It means that physiological systems involved in erection and ejaculation rely on blood flow and nerve signaling that benefit from periodic activation. Let's start with erectile function. An erection is fundamentally a vascular event. Blood vessels dilate, smooth muscle relaxes, nitric oxide is released, blood fills erectile tissue. That tissue expands and compresses venous outflow, maintaining firmness. When this system is rarely activated over long periods, particularly in older men who already have age-related vascular changes, blood flow efficiency can decline further. This is not dramatic, it is gradual. Morning erections often decrease first, then rigidity may lessen. Recovery time increases. Many men assume this is irreversible aging. In reality, part of it is vascular conditioning. Just like muscles respond to use, vascular tissue responds to stimulation. Occasional erections help maintain elasticity and oxygenation of panel tissue. When erections become extremely infrequent for long periods, tissue may become less responsive. This is not a moral issue, it is biology. Now, let's talk about hormones. Testosterone naturally declines with age at about 1 to 2% per year after the mid-30s. That decline is normal. However, testosterone production is influenced by signals from the brain, specifically the hypothalamus and pituitary gland, which respond to overall physiological and psychological stimulation. Sexual arousal activates dopamine pathways. Dopamine influences hormonal signaling. This does not mean masturbation dramatically increases testosterone long-term. Research shows short-term fluctuations are modest, but regular sexual health engagement is associated with better overall endocrine rhythm compared to complete suppression of sexual expression over long periods. More importantly, sexual inactivity can sometimes reflect or contribute to broader lifestyle withdrawal, less movement, less social engagement, less self-care, and that combination absolutely impacts testosterone levels. Low testosterone is not just about libido. It affects muscle mass, bone density, mood stability, and cardiovascular risk. When men tell me they feel flat, less driven, less motivated, sometimes what we discover is not just a lab number. It is a broader pattern of disengagement from vitality itself. Now, let's address the prostate. The prostate produces sinal fluid. Ejaculation clears prostatic secretions. Large population studies, including research from Harvard, have suggested that men who ejaculate more frequently over their lifetime may have a lower risk of certain prostate conditions. The mechanism is not fully understood, but one theory is that regular emptying reduces accumulation of inflammatory substances. This does not mean abstinence causes cancer. That would be inaccurate. But it does suggest that regular ejaculation is not harmful to prostate health in most men and may be associated with protective effects. What I often see clinically is not catastrophe, it is discomfort, pelvic pressure, mild congestion symptoms, urinary changes that overlap with benign prostatic hyperplasia, which is extremely common with aging. Regular ejaculation alone does not cure prostate issues. But healthy sexual activity is part of a broader pelvic health picture that includes hydration, movement, diet, and cardiovascular care. Now, let's talk about something rarely discussed: emotional vitality. Sexual stimulation releases dopamine, oxytocin, and endorphins. These neurochemicals regulate mood and stress response. In older adults, especially those who live alone, the absence of physical touch and sexual expression can contribute to feelings of isolation. This is not weakness, it is neurobiology. Men are often taught to suppress emotional needs. When sexual expression disappears entirely, some men lose not just desire but a sense of embodied connection. They may feel less alive in subtle ways. I have spoken to men in their 70s who told me they thought desire disappearing meant they were donating men. Done being vibrant, done being relevant. That belief is far more damaging than aging itself. Healthy sexuality in older age does not have to look like it did at 30. It may be slower, it may require more stimulation. It may involve creativity and adaptation, but it remains a part of human physiology for many men well into advanced age. This conversation is not about compulsion. It is not about pressure. It is not about frequency targets. It is about removing shame and understanding that sexual health is integrated with vascular health, hormonal balance, pelvic health, and emotional well-being. If you are over 60 and you have stopped all forms of sexual activity because you believed it was inappropriate or unnecessary, I encourage you to reconsider that belief through a medical lens, not a cultural one. If you have erectile changes, talk to a physician. If you have low energy, test testosterone properly. If you have urinary symptoms, evaluate your prostate safely. Avoid extreme claims, avoid fear-based messaging. Aging is not collapse, but neglecting circulation, hormones, movement, and emotional engagement can accelerate decline. Vitality is maintained through use, through stimulation of mind and body, through connection, even private connection with yourself. Now, let's move forward in a grounded, practical way. Not from fear, not from exaggeration, but from physiology, psychology, and lived clinical experience. If you are over 60, the question is not whether you should be performing like you did at 30. The question is how you maintain circulation, hormonal balance, pelvic health, and emotional vitality in a way that fits your current body. Aging changes response time, it changes nerve sensitivity, it changes recovery periods. That is normal. What is not inevitable is total shutdown. Let's start with frequency because that is often the first question men ask privately. There is no medically required number. There is no universal prescription. Some studies observing prostate health have associated more frequent ejaculation with lower prostate cancer risk. But those are correlations over decades, not rigid rules. What matters most is that sexual function does not disappear purely from neglect. For many older men, once or twice a week of sexual activity, whether with a partner or alone, is enough to maintain erectile responsiveness and pelvic circulation. For others, less frequent, but consistent engagement works. The key word is consistent, not compulsive, not extreme. Consistent when erections occur, oxygen, rich blood enters the erectile tissue. That oxygenation helps maintain tissue health. In men who experience long-term erectile dysfunction, especially after prostate surgery or long periods of inactivity, urologists sometimes use what is called penile rehabilitation. The concept is simply preserve blood flow to preserve tissue health. This is not about performance, it is about preservation. Now let's talk about stimulation quality. At 60, 70 or beyond, arousal may take longer. That is normal because nerve conduction slows slightly with age and testosterone levels are lower than in youth. Instead of rushing or testing yourself, allow time. Direct stimulation, visual stimulation, fantasy, or memory can all activate arousal pathways. The brain is the primary sexual organ. One of the most overlooked factors in erectile decline is anxiety. When a man worries about whether he will achieve an erection, stress hormones increase, cortisol rises, adrenaline tightens blood vessels. The very system required for erection becomes restricted. Self-pleasure done without pressure can actually reduce performance anxiety because there is no external expectation. It allows a man to understand his current level of responsiveness without fear of judgment. Now, we need to address cardiovascular health because erections are vascular events. If you have high blood pressure, diabetes, high cholesterol, or a history of smoking, these directly impact erectile function. In many cases, erectile dysfunction is an early warning sign of vascular disease. Maintaining sexual function is not just about stimulation. It is about walking regularly, maintaining healthy weight, controlling blood sugar, optimizing blood pressure, and sleeping adequately. These improve nitric oxide availability, which is essential for erections. Men sometimes search for a single solution. There rarely is one. The male body is integrated. Let's discuss testosterone responsibly. Testosterone declines gradually with age. That is expected. Not every man with lower desire needs testosterone therapy. Symptoms matter more than numbers alone. If you experience persistent fatigue, decreased muscle mass, low mood, low libido, and lab-confirmed low testosterone on repeated morning testing, then medical evaluation is appropriate. However, sexual activity itself does not dramatically elevate testosterone long-term. What it does do is support normal endocrine signaling and psychological engagement. There is a difference between maintaining rhythm and creating artificial spikes. If you are concerned about testosterone, focus first on sleep resistance training, adequate protein intake, sunlight exposure for vitamin D, stress reduction, and moderate sexual activity. These are foundational. Now let's return to the prostate. Benign prostatic hyperplasia or BPH is extremely common with aging. It causes urinary frequency, weak stream, and nighttime urination. Regular ejaculation does not eliminate BPH, but it may reduce temporary congestion and improve comfort for some men. More importantly, ejaculation is not harmful to the prostate in healthy men. Many older men avoid sexual activity because they believe it strains the heart or worsens prostate issues. For most individuals cleared for moderate physical activity, sexual activity is comparable to climbing 2 flights of stairs in terms of cardiovascular demand. If you can safely walk briskly without chest pain or severe shortness of breath, sexual activity is generally safe. Of course, always consult your physician if you have unstable heart conditions. Now, we need to discuss emotional health with honesty. Aging often brings loss of partners, retirement, reduced social roles, physical changes. When sexual expression disappears entirely, some men unconsciously interpret that as the end of desirability. That interpretation can fuel depression. Dopamine and endorphins released during arousal and orgasm contribute to mood regulation. They are not cures for depression, but they are part of a broader neurochemical balance. Touch, even self-touch, maintains body awareness. It reinforces that you are still a living, responsive organism. Shame is often the greatest barrier. Many men grew up in cultures where masturbation was framed as immoral or weak. Those early messages can remain powerful even when medically inaccurate. There is no evidence that moderate masturbation in older age causes weakness, hormone depletion, or cognitive decline. Those myths persist culturally, not scientifically. That said, balance matters. If sexual behavior becomes compulsive, interferes with daily life, or replaces meaningful social interaction entirely, that is different. The goal is integration, not isolation. Let's talk about erectile medications briefly. Drugs like sildenafil and tadalafil improve blood flow by enhancing nitric oxide pathways. They are effective for many men. However, they work best when underlying tissue health is preserved. Occasional natural erections help maintain responsiveness, which may improve medication effectiveness when needed. If you rely solely on medication without any baseline stimulation or engagement, the tissue can still lose elasticity over time. Think of medication as support, not replacement for circulation. Now consider pelvic floor muscles. The pelvic floor contributes to erection rigidity and ejaculation. Schedule exercises are not only for women. Older men benefit from strengthening these muscles. Contract the muscles you would use to stop urine flow. Hold for 5 seconds. Relax and repeat 10 times. Do this 2 to 3 times daily. Stronger pelvic floor muscles can improve erectile quality and urinary control. Hydration also matters. Chronic dehydration thickens blood slightly and may worsen urinary symptoms. Adequate water intake supports vascular health. Sleep is another pillar. Most testosterone production occurs during deep sleep. Men who sleep fewer than 6 hours regularly often show lower testosterone levels and worse erectile function. Now let's address fear directly. Stopping masturbation does not cause sudden death. It does not automatically cause cancer. It does not guarantee hormonal collapse. Extreme claims create anxiety, and anxiety harms sexual function. What long-term total disengagement can contribute to is gradual deconditioning, vascular, hormonal, psychological, combined with aging and chronic disease. That deconditioning can accelerate decline. The solution is not panic. It is informed, moderate engagement. If you have not engaged sexually in months or years, start gently. Do not test yourself aggressively. Allow natural arousal without forcing erection. Use lubrication to prevent discomfort. If erection quality is limited, that is information, not failure. Seek medical evaluation if needed. Remember that intimacy does not have to be goal-oriented. Orgasm is not mandatory every time. Sensation itself stimulates circulation and neural pathways. One of the most important shifts for older men is redefining masculinity. Masculinity is not measured by frequency or performance. It is measured by self-awareness, health stewardship, and emotional presence. Taking care of your sexual health is not indulgence. It is preventive care. If you are in a relationship, communication matters. Many partners also carry assumptions about aging and sexuality. Honest conversation can reduce pressure and create shared understanding. If you are single, self-pleasure can be a healthy expression of bodily autonomy. There is no expiration date on feeling. As you age, your body becomes more responsive to overall health patterns. Small, consistent habits compound: walking daily, lifting light weights, eating fiber-rich foods, managing blood sugar, sleeping deeply, engaging sexually in moderation. These together create resilience. The male body after 60 is not fragile, but it is less forgiving of neglect. So here is the balanced truth. You do not need to obsess over frequency. You do not need to chase youth. You do not need to feel shame. But maintaining some level of sexual engagement, if medically safe for you, can support circulation, pelvic health, mood regulation, and a sense of vitality. If you have erectile dysfunction, urinary symptoms, or low testosterone symptoms, seek professional evaluation. Do not rely solely on internet claims. Medicine today offers safe, effective options tailored to individual health status. Aging is not the end of sexuality. It is a transition into a slower, often more intentional form of it. Your body still responds to care. Your hormones still respond to rhythm. Your brain still responds to pleasure. And your vitality is influenced far more by engagement than by silence.